it's Jessica DeMassa with WTF Health. What's the future of health? I am talking to the who's who of health tech and healthcare innovation. And joining me right now, I have Michelle Carnahan, the president of 30 Madison. Good to have you here.
Nice to be here. Thank you very much.
All right, we are going to check in on the Nurx acquisition because the last time I spoke with somebody from 30 Madison, I talked to Steve, CEO, and you had just acquired Nurx. And so Nurx was big business, going direct to consumer with contraceptive, women's health, merging with you guys that were more in the migraine, allergies, that kind of stuff space. So tell me how the integration is going.
I think the integration is going very well. I mean, if you think about what we're trying to do is we are trying to really give women the opportunity to have their sexual and reproductive health needs met in a stigma-free kind of environment that really meets them where they are when they're there, and we can talk even a little bit about where we're going with that over time.
Ooh, well, like let's talk about that actually right now. So tell me where that's headed, because the brand now it encompasses all of this. Yeah. So tell me a little bit more about like where is the focus going to be more increasingly on women's health and in that direction, or are you going to stay kind of general as well?
Absolutely. So, I think we're in a really unique place right now with women's reproductive health. It was interesting when Roe v. Wade happened, we saw a 300% increase in emergency contraception almost overnight. And it was really great to be there when people were really questioning what's the future of this, and also to have content that helped them. Like, what is emergency contraception? Emergency contraception isn't an abortion. It cannot take away a pregnancy. So really helping women understand their sexual and reproductive health. Nurx has had about 1 million patients in treating birth control and sexual and reproductive health, and so really proud of that. But one of the things that we want to do for women is women are more than their reproductive organs. Yes. And so we've really started to work with the consumers who come to us and trust us with their health care on what else is impacting them. And one of the places where we started to go last year was dermatology, and really working with women on dermatological issues. It's interesting, if you think about a appointment with a specialist, 25 to 30 days to get an appointment. Then if you have an appointment, it's 2 hours for a lot, at a minimum, just going to the office. And for a lot of these women, they've got kids, they've got a job. So we've launched in dermatology, we have sexual and reproductive health, and we're really excited to be launching in mental health.
Yes, I heard about that. So let's talk about that news. No, it's exciting. No, it's good. I like hearing the backstory. All right, so that's what this is all about. So tell me a little bit about the mental health solution. What's going on with this?
Yeah, I mean, the thing about mental health is 1/3 of all people in this country live in a spot where there just aren't enough mental health care providers. 80% of rural counties in this country do not have a psychiatrist in their county. And so what we're going to do with mental health is really go mild to moderate depression, anxiety, OCD, medication management, cognitive behavioral therapy that we'll have as a part. We'll have an opportunity, if things need referred out, to refer them out. So getting those folks to psychiatrists that need them. We're not going to do controlled substances. I mean, we're going to have some. It's as important to know what you are going to do as you aren't going to do. But we're going to have places to like help move people through their mental health journey. Mental health, much less than when I started in the industry over 25 years ago on Prozac. Mental health, much less of a stigma today, but hard to find mental health care, and it's becoming more and more predominant. So we're really excited to, again, meet women where they are.
Very cool. So talk to me a little bit about the revenue model here, because you guys, to me, always I put in the direct-to-consumer bucket, but I'm kind of wrong right now, because you guys are actually growing that enterprise side of your business. So tell me a little bit more about that.
Yeah, look, direct-to-consumer is incredibly important to us. It's where we started. Why did we start there? Because, I think you fix healthcare by getting 3 things right. Number 1, you got to get healthcare right. We don't sell Hershey bars. Not that there's anything wrong, but that's not what we do. It's healthcare, right? You got to get the tech right. The tech has to be able to make it more efficient, and you've got to get the consumer piece right. There's no reason why healthcare has to be a horrible experience, right? And so one of the things we've really worked to do is build a consumer business to get to know our consumers. And, we were talking, you aren't that wrong. A little over a year ago, we were about a revenue split of 95% consumer, 5% enterprise. We're 70-30 today. And we get there in a few different ways. We get there through fee-for-service models for partnering with the PBMs, but also having kind of special partnerships with UnitedHealthcare, working with them on migraine, working with CVS both in-store and out. So really excited for that enterprise piece. Look, 30 Madison was founded on and is about access and affordability, outcomes, and changing the consumer experience. And access is a lot about meeting consumers where they are. So we want to be out there with our consumers, but also if you have a plan, we let you enter that in when you come into our site. We see if it's paid for, and bada bing, bada boom, or whatever that.
I love it. All right, Michelle, last thing for you. What's ahead? So, I mean, like, I was actually really excited to talk to Steven, your CEO, about the acquisition of Nurx. And as you guys continue to build the 30 Madison empire, got your eyes on anything else? I mean, now you're in the mental health space. I mean, where are we going from here?
I'm super excited about three things, right? The first is I am super excited about women's healthcare. I am a big proponent of women in healthcare. 80% of healthcare decisions are made by women. 80% of the mothers drive their children's healthcare decisions, and 59% of single women make someone else's healthcare decision. I think by knowing women as a consumer, knowing them as a person on their healthcare journey, we're going to be able to do amazing things. I'm super excited for that. I'm excited for where we go with enterprise over time. None of us is big enough to solve a healthcare issue, and so I'm really excited to how do you get to value-based care? How do you deliver value? And then third and finally, I'm excited to mental health. What's after mental health? You know, there's a lot going on in the metabolic space. We really use our consumers to help us understand where do we go next? What do they need? We're about chronic care. And if you think about chronic care, 80% of the healthcare dollars are spent on chronic care, and of that 80%, about 2/3 of that is spent on folks with more than one chronic condition. And so we're excited for cross-care and comorbidities.
That's awesome. I love that, especially number one. I love the more expansive definition of women's health as you guys are looking at it, and that's really exciting. So we're going to have you back on, Michelle. Okay. Get into some of the data and the details about how women's health is different in that more broad and expansive definition. I love it. Thank you so much for coming by.
Thank you.
Awesome. I'm Jessica DeMassa here at Health 2022 with Michelle Carnahan, the president of 30 Madison. Check out more content on my YouTube channel. It's youtube.com/WTF Health. We'll talk to you guys soon. Take care.